Hi everybody, today I am so excited to introduce you to Dr. Trent Smallwood.
Hey Julie.
And he is going to do my Invisalign, so he is a dentist.
I am.
You are.
That's what I do. I fix teeth. Yes.
And hallelujah for that. So I have been, my teeth, as you see them every single day, and my big smiles are not horrible. It's actually more functional for me, but it's been bothering me and for long enough that I decided it's time, as I'm looking at my pictures all day, every day, to fix them.
Right, and really you're honest about all that, because the situation in your case is simple. I mean, you never had braces before, which is amazing. She has a smile like this and never had braces, which is amazing to me, because you really aren't that bad. But
so really quick, I have 3 brothers. All 3 of them got braces, and my teeth were good enough that
you got the short end of the stick.
Right.
Oh, that's too bad. Well, I guess that's good now, because we can fix you simply. They probably had to have the traditional braces.
Yes.
Which is the worst, because they look terrible, especially as an adult. For a kid, they don't care. But Invisalign is nice because it's invisible. From 3 feet away, you can't even tell they're in, which is a really nice thing. And to kind of go back to your case, really, Jules is pretty simple for the most part. Her biggest issue is that her teeth are not quite in the best position. Not bad, but certainly could be improved a little bit. And the function. We want to keep you from grinding your teeth in the future, which she's doing a little bit now. And part of that is where the teeth are positioned, so I think we can improve that. Plus, when you see at the end, kind of the before and after, it will be a tremendous result, but not catastrophic. I get some teeth that are so bad, their teeth, if they're coming to meet me, their teeth get there 10 minutes before the rest of their body does. I want you to fix my husband's teeth because he pokes me in the eye when he's using a great fix.
I'm glad my teeth don't look
No,
like that.
they're not by any means, but those are the things we can fix now with Invisalign. We couldn't used to, but now we can. That's pretty cool.
So that's so cool. So if you grew up and didn't get the braces like I didn't, now is the time. It doesn't really matter. And Trent, you told me too that nobody's even going to notice. Even in my pictures, you're not going to notice. When I'm speaking, you're not going to notice. So why not do it, right? You're never too old to fix your teeth. And one thing we were talking before we came on is that, we research if we're going to go to if we need surgery, an orthopedic or plastic, you go and you research your doctors and you make sure you're going to the best one. And I think that most people, when they go to a dentist, they just go to the local neighborhood dentist. And that's a big mistake, isn't that right?
It is, because a lot of times a cosmetic dentist, I do all facets of dentistry, but my concentration is in smile enhancement, whether it's veneers or Invisalign or a combination of both. And you're right, you go to your dentist, you've been going to it for 22 years, and you want to do like what you want to have done. And he or she goes, yeah, I can fix it, I can do this. I want to do Invisalign. And either they have to go find out and get certified in that area, or they can put you in traditional braces, which isn't the best, necessarily for adults. But it's easy, quick, but you've got to find somebody that's experienced. I've done thousands of these Invisalign cases, and not every dentist has. And there are a lot of complexities to it. I was telling you about the young lady I'm just starting in her teeth.
Yeah.
She had 3 years of orthodontics from an orthodontist, and they're still not done. And now she's coming to me, and I'm going to put her in another year of Invisalign to get her to ideal.
And not only that, but you have not only been doing this forever, but you also train dentists to do all these things as well. And on top of that, you've been picked by your peers 5 years in a row as the top dentist in town.
Yes.
So, if you're going to go do it, you're going to spend the same amount here as you will there, but you're going to get the results here.
Exactly. It's very predictable. I have and just like you mentioned, when I teach other dentists, I have a very specific way to be able to make smiles ideal. Now, I'm not going to bore you with all the specifics of it, but it's widening out the smile, making it full, like a Julia Roberts kind of smile, and maximizing what you have as assets. If I can get them into a better position, de-emphasize certain things, accentuate others, just like plastic surgeons do on different parts of the body, I do with teeth. But not everybody has that artistic eye, and that's where I get frustrated for me, because probably 30% of the cases that I do are redoing some of those situations. It's not like it's negligence or they've done anything terrible. It's just they didn't put that oomph on there. Yeah, the excitement that really makes it smile.
And I didn't think about that either. That I didn't realize that not only is it about getting straight teeth, but cosmetically how it changes the appearance of your face. So we were really talking about that. I found that so interesting.
Fuller lips, for women especially, sometimes it kind of
ladies
plumps up the lip a little bit to get rid of lines along the side of the lips.
Wow.
All those things, yes, absolutely.
Okay, so guess what? If you're interested in getting Invisalign done on your teeth, you mention Lifestyle Jules and you will get $1,000 off. On top of that, we're gonna come back and talk about all the other things that Dr. Trent Smallwood does. So stay tuned. for all of our next videos coming up. Have a great day, everybody. Bye.